It's only fair for those who are to Sabbath school on time to start on time, isn't it? So I will say welcome. My name is George Guthrie. I am a family physician from a little town called Orlando. You might have heard of it, okay? It's south of here a little bit. And I'm speaking for the VegaFest program tomorrow, and so was invited to speak to you this morning for Sabbath school. And I have decided to give you a little bit of a history of lifestyle medicine. Have you all heard of lifestyle medicine before? Anybody recognize at least a little bit about that? Seventh-day Adventists for years have been interested in how the 8 natural doctors actually can save us from getting disease and even cure disease. Although we live in a sinful world and bad things happen to good people who make all the right decisions, right? So an enemy has done this, is what Scripture says. So I thought it would be helpful or interesting to you to hear a little bit about lifestyle medicine and how it's come about. I'm afraid the USB, I don't even have that kind of a connection in that computer. So all that effort for nothing, so apologies. So I'll just walk over there and push the slide when we need to. So we're trying to get a little quicker so I could do it from the middle here rather than going kind of back and forth. So I've had an interest in lifestyle medicine for quite some time, although that's not what we called it when I kind of got started. I graduated from Loma Linda University in 1981, and because I was interested in nutrition at that time, I paid attention in biochemistry class. So I heard a lot of nutrition because biochemistry is full of nutrition. So that is kind of how I got my interest. And I'll tell a little bit of that story, my story and lifestyle medicine together. Hopefully you'll be challenged and encouraged, for there's a lot of truth. The laws of health are God's laws. And when we keep God's laws, we get to enjoy more health. I like to tell the young folks, and we're all young folks here, right? You don't have to keep God's law. You get to keep God's law. God told us what was best for us because He knew it was best for us. I'd like to start this morning with a word of prayer, if I may. Our Father in heaven, we're grateful for the opportunity to come to Sabbath school this morning, to worship with your people, to learn about you and the laws that govern your universe, the laws that govern our bodies. Guide us, send us your Spirit as you have promised, and lead us into truth. In Jesus' name, amen. So my journey continued after graduating from medical school at Hinsdale Hospital. Anybody ever been there before? Okay. I spent 3 years of family medicine residency there and really appreciated what I learned. Now, at the residency at that time, there was a gentleman volunteering his teaching services. He came out 1 day a week from downtown Chicago and taught in the residency. And he volunteered his time. He refused to accept pay for that teaching time. We all, the residents, really respected him. His name was Don Bennett. Now, you probably haven't heard the name. He was volunteering his time. He was head of pharmacy, a PhD in pharmacy, and he worked for the American Medical Association as head of their drug section. Now, in those days, well, today we have the PDR. For those of you in the medical field know, PDR tells you all about all the drugs that are available. But the industry writes that. So the American Medical Association at that time said, you know, we really need some unbiased information. So Don Bennett was in charge of writing a book called Drug Evaluations. And that was done on a regular basis over several years. We all respected him greatly, and he would lecture to us. He would say, gentlemen, ladies. Mrs. Smith comes into your office at 47 years of age. She's got some pain in her knees and in her hips. It bothers her when she first gets up in the morning, and then over the 15 or 20 minutes it'll get better, and she does fine through the day. She's complaining because this pain is getting worse. What are you going to do for her? And someone would say, give her some ibuprofen, right? And he would shake his head. And one of the other, residents, more senior, would say wisely, acetaminophen, Tylenol, right? And he would shake his head, and we would say, wait a minute. Does he really want us to give her narcotics? Because, once you've covered it, what are you going to do? And he would shake his head and say, no. What is the non-drug therapy? To hear that from a doctor of pharmacology, what is the non-drug therapy, was a kind of a shocking experience every time he did it, and he caught me every time he did this, okay? It wasn't just osteoarthritis, but other diseases as well. What is the non-drug therapy? So that was pushed into my medical mind. And as I approached patients, I tried to put that right up front. What is the non-drug therapy? It was a good foundation for thinking about how to help people get better. When I moved from the little town of Chicago to Guam, out in Micronesia, working in the Guam SDA clinic out there. I was there for about 7 years. I was interested in nutrition, for I had been a little bit on the overweight side since I was young. The short, fat kid, I don't know if anybody understands that. I never had a growth spurt, so I had no idea what that meant, except, fighting that bulge constantly. So I had the interest, and my wife enjoys health education, and indeed we were running some cooking schools and those types of things for our mission and clinic there. I was trying to help patients. While I was there, I was looking at the scientific literature, and I became acquainted with Dr. Gerald Reaven. Dr. Gerald Reaven from Stanford University in 1988 was given the Banting Award by the American Diabetes Association for his work in helping us understand something about diabetes. Diabetes comes with this insulin resistance, and insulin resistance pushes up the insulin levels, and insulin levels, Dr. Reaven shared with us, is the root cause of several diseases. Diabetes, yes, but also hypertension, heart disease, and obesity. Insulin is a growth hormone, so it tends to make us gain weight. Insulin is associated with elevated blood pressure, maybe because it makes the kidneys hang on to sodium, it increases the water in the pipes, or maybe it's the insulin resistance itself that makes the pipes less able to dilate, because it's an active sort of a thing for them to kind of dilate. So he coined this phrase called Syndrome X. Now the cardiologist said, you can't have that name because we already have it. And so it's now changed to something we call metabolic syndrome. Jerry Olewski, there on the right, is from University of California, San Diego, and he's done some great work telling us about insulin resistance being reversible at the cell level. And he just laid that out. I was reading that literature, and I go, wait a minute, can that be possible? We can actually reverse. Where does the insulin resistance come from? Well, the cells have too much energy going in, and that energy going in is not needed, so the cells say, I don't want any more, and they become insulin resistant. And that adds up over time. And he demonstrated way back then in the 1980s that that insulin resistance was reversible. So that was important to me. And I had a patient come into the office at one point. Ralph, we're going to call him. I was there at the Guam clinic. Ralph came in with some funny skin lesions. They were kind of yellow and raised and a bit irregular, maybe 1.2, 1.4 centimeters in diameter. And he said, "Doc, what is this?" I'd never seen him in the clinic before. Indeed, he'd never been there before. It took me about 15 seconds for it to click. I said, "I think those are cholesterol deposits under your skin." Usually they're around the eyes. He had them other places in his body. "Let's check your cholesterol. Has anybody ever told you had high cholesterol before?" And his answer was no. So I said, "Well, check the cholesterol. If your cholesterol is up, I don't feel like I need to biopsy those." You know, biopsy is what we do when we're not sure what it is. We can kind of look at it under the microscope or have the pathologist look under the microscope and share that with us, that diagnosis or what they see. So Ralph was agreeable, and I wrote out the lab sheet. We had papers in those days, right? That's long before EMRs. And I remembered from medical school, I had been taught that when your cholesterol is high, you're also more likely to have hypertension and be overweight. Well, I could look at him and knew he was overweight. And I looked at the chart, and sure enough, his blood pressure was up. And another thing I learned is that when your cholesterol is up, you're also more likely to have diabetes. So I put a blood sugar on the list. And Ralph went and got his fasting lab tests done and came back the next week, 4 or 5 days later, and I sat down in the office with him and started to look at the lab tests. I was fascinated. Ralph's fasting blood sugar was over 200. Pretty amazing. His cholesterol was high, really high, like over 300. Okay, so a blood sugar over 200, a cholesterol over 300. So I knew we had a problem here, and I said, "Ralph, your cholesterol is high. We don't need to biopsy those lesions. So, but you know, we need to bring that down, and we need to talk to you about some diet changes." "Did you know you had high cholesterol?" He said, "No." I said, "Now, your blood sugar is also kind of high. As a matter of fact, in those days, we made the diagnosis of diabetes with a fasting blood sugar above 140. You know, they since changed it. They changed the rules. But 140 was kind of where we looked, and here he was over 200. I said, "Ralph, did anybody ever tell you had diabetes?" He said, "No." I said, "Well, it really looks like that may be what's happening here. The first thing we need to do is to change your lifestyle." And then he seemed to understand that. And then I went on to say, "Now, you know, if those blood sugars are up for too long, they cause blindness and kidney failure and infections and sometimes amputation. So we really need to control these things. In my experience, blood sugars that high, lifestyle won't manage it completely. You probably need some medications." So I went on to explain that there's medications that can help bring the blood sugar down. And Ralph nodded his head and seemed to understand. Then I told him, I said, "Ralph, in my experience, we're going to do our best. But in my experience, people with blood sugars as high as you have are going to need to have insulin to bring the blood sugar down." And I still remember Ralph's reaction. Ralph was on Guam, an Italian businessman, okay, so a rather interesting mix. And when I said the word insulin, there was a veritable Vesuvius of emotions that came out as Ralph said, "I will never take insulin. I would rather die. I will never take insulin." I've seen this reaction in other people since, but that was a Ralph's reaction. And so I waited until the, the steam, the lava kind of slowed down a little bit. And I was thinking about what I had learned from Gerald Reaven and Jerry Olefsky. And I said, wait a minute. If insulin resistance comes from too much energy in and not enough energy out, that is, the cells don't need it, then what would happen if we were able to get somebody to exercise when their blood sugar was low, when there was little energy around? Just that should help to reverse it. It seemed that that's what I was learning from Dr. Olefsky. So I'm thinking about that as the Vesuvius is blowing. And once it calms down, I said to Ralph, I tell you what, as long as you do what I tell you to do, I won't even mention insulin or pills. And I still remember Ralph going, Doc, I'll do it. As he, kind of hit the air. I love stubbornness, okay? Stubbornness is miraculous. If you can get it going your direction. It's a bit of a problem if you have to fight against it. As a young physician, I'd learned not to try to do this, but to try to do this, okay? We move together with our stubbornness. And Ralph indeed decided to do it. I explained to him, whole food is better than refined food. I like apples. Do you like apples? How many can you eat before you're full? I might get 3 or 4. But you can smash the apple up and get juice out and put it at the glass at the end of your knife, and you get 7 to 8 apples worth of energy. The fiber is gone, and you take it down quickly. Now, is apple juice bad? No, but apples are better. Corn. When I was a teenager, I grew up in Northern California. We'd go over to the coast, and even in the middle of the summer, we could build a bonfire on the beach out of driftwood and roast corn. I think my record was 13 ears of corn, okay? And, it's good, even with the sand, okay? We'd wrap it, of course, in foil. But, that corn can be smashed by the processor, put in a bottle. It says corn oil, no cholesterol because plants don't make cholesterol. So we buy it off the shelf in the grocery store. We make a salad dressing. We put it on our salad. A tablespoon of this is 16 to 18 ears worth of corn oil. Is corn oil bad? No, it's probably one of the good oils for us, but it's concentrated. Does that make sense? So I shared that with Ralph, and then my next one, he looked at me a little funny. Ralph, do you eat grass? He said, no, I don't eat grass. I said, are you sure? The cow eats grass, takes all the fiber out and drops it behind, and concentrates, you'll excuse the humor, the calories. So, it's highly concentrated. So when you take the cow meat, the beef, the cheese, those types of things, you're getting a lot of calories, and we need to decrease the calories. And then when I sent Ralph home, I gave him one other rule. I said, Ralph, we need to get you fasting state and exercising. I don't want you to have anything more than maybe a piece of fruit at night. So big breakfast like a king, lunch like a prince, supper like a pauper. It takes 8 to 12 hours to reach the fasting state. When you get up in the morning, before you eat, I want you to do some exercise. I'm not going to tell you how much. I'm not going to tell you how long. I am just going to tell you do some exercise. Ralph came back the week later and said, I said, how did it go? His blood sugar was actually down. He had come by the office and got a blood sugar machine, so he was checking his blood sugar at home. His blood sugars were still terrible, but they were lower than they had been previously, and I didn't say anything about insulin, and I didn't say anything about pills. Ralph said, and these are his words, the first morning I waddled 50 feet from my front door. Okay, that was his exercise and back. By the time he was coming to see me, it had increased to 30 minutes, and he was headed down the road a quarter mile or so, and then coming back. Over time, Ralph came back to the office on a regular basis, and each time his numbers improved. His weight came down, his blood pressure came down, his cholesterol came down to normal, and his blood sugars came down to normal. I still remember the very last visit I had with Ralph. It was really quite amazing. It had been almost exactly a year since I'd seen him the first time. I had kind of spaced out the visits. I felt guilty having him come in to tell me that everything was perfect. Usually doctors are supposed to fix something. Instead, I was just patting him on the back and saying, you're doing good, Ralph. Keep it up, right? Ordering another test, whatever was appropriate. At 1 year, Ralph's blood sugars were completely normal. He said, Doc, last night I tried a little ice cream to see what would happen. And my blood sugar didn't shoot up. He was down 60 pounds total. And his blood pressure was normal, no pills. This is it was a complete change of my way of understanding medicine. You mean this can actually be taken care of without pills, without insulin? The disease could be reversed? The office visit was over in 45 seconds. I had learned everything I needed to know, but I had never seen it happen before. And so I tried to extend the conversation. I said, Ralph, it's been almost exactly a year since you were here the first time. I asked you to do some incredibly dramatic things. How was it? And Ralph's face kind of grimaced up a little bit, you might say, and he said, well, Doc, there was one problem. I'm like, oh no, what could it have been? And my face, my brow furrowed as well. I said, what was it, Ralph? Well, he said, this last year, I had 2 custom suits made, and when I got home, they were both too big. And then he broke out in a big smile. And I said, Ralph, you got me. So I sent Ralph home, and I said, Ralph, from what I can tell, you're healed. Keep doing what you're doing, and let me know when I can help you. I'm happy to see you for an annual physical exam if you think you need it. If you have a health problem that comes up, I'm happy to see you again. And I never saw Ralph again. After that time, our 7.5 years on Guam, I decided to go back to Loma Linda University and do a Master's of Public Health in Nutrition. And when I was there, I thought my interest is the reversal of chronic disease. And what better way to prepare a paper for one of my classes but to tell Ralph's story. These were the days before HIPAA. So I wrote to the folks on Guam. I said, would you please send me Ralph's chart? I need it for my classwork. And they sent it to me. I found that Ralph, after I had left, and this was like 4 years later, had showed up at the clinic with a little bit of a sinus infection and had gotten it taken care of, but his diabetes had not come back. His cholesterol was good. So that was the joy. It's the first time I'd ever seen it happen. What a difference now to know that it's actually, the diseases are actually reversible. Dean Ornish published his work from the University of California, San Francisco. Any of you heard of Dean Ornish? See, when I was in medical school, we had this argument going that heart disease was not reversible. It's hardening of the arteries, and some of our professors at Loma Linda would say yes, and some would say no. My clue came when I was with Dr. Carol Small, the pathologist, head of the pathology department. You know him, just a prince of a man. And I was doing my senior rotation in pathology, and we spent an hour or so looking at microscope slides from the surgeries the day before, whatever it may have been. And he said, "Okay, George, it's time to go. We're going to go do an autopsy." Now, I don't know if any of you have had the opportunity to do an autopsy. I had gone through anatomy the first year, so I was supposed to be used to it. But it's a little different when the body has been in formalin for a while. I discovered that the smell is horrendous. If you ever have an opportunity to do don't, okay? So the woman to be examined was elderly, and Dr. Small didn't tell me what she died from. Of course, that's what the autopsy is supposed to do, right? So we looked in the intestines. We looked actually at the brain. There hadn't been a stroke. There was no cancer in the liver or the spleen or the intestines. And opened up the chest to see what was going on in the heart. The truth is, the smell was so bad, I could hardly keep from throwing up. And so I didn't say much. But when we got to the heart, Dr. Small opened up and kindly showed me all the valves and what was going on inside, and took a scalpel and opened up the left main coronary artery. And it was perfectly clean. All the cadavers that I'd seen in the anatomy lab had atherosclerosis, that stuff that's associated with heart attacks. And the artery was perfectly clean. I found my voice, and I said, "She must have had a very good lifestyle." And Dr. Small said something to me that I had never heard anywhere else, and I've never seen written down anywhere. He said, "Everybody who dies with cancer dies with clean arteries." Well, if that's true, then lifestyle can change it. It's not just cancer that can clean out the arteries. Lifestyle can change it. So that was way back in 1981. And in 1991, Dean Ornish demonstrated for the scientific world that people who changed their lifestyle could actually reverse the atherosclerosis. Before that, there was the big argument. Since then, most doctors know, although I still have patients who tell me that their cardiologist says, no, you can't change that with lifestyle. Well, they just haven't read the literature. There is a growing understanding. At 5 years, there was still continued reversal, and it depended on how much people stuck with the lifestyle. The lifestyle Dean Ornish used was a 100% plant-based diet, minimally refined, exercise, social connectedness, stress management. So those things all coming together led to the disease reversing. Now, there was a fellow by the name of Caldwell Esselstyn who heard that, got interested in it. He was actually a breast surgeon from the Cleveland Clinic, breast and thyroid. And he got interested, well, so we have these cancers in some places, but not in others. What are the lifestyle factors? So he went to try to look and began to discover the literature. As he retired from his surgery practice, he began to do heart disease reversal and help people with their lifestyle using a very strict plant-based diet. He was able to help people. And he followed them for, I think, was it 18 years when he finally published his last result. Anybody who stuck with the program had no recurrent heart events. The people that came into it were those who were too sick to have cardiac surgery or other procedures, or who refused those procedures. So that's encouraging to know that what was done in a small way in Dean Ornish's study over a year's time was actually extendable over a longer period of time. So lifestyle can make a huge difference. Let's see. Was that the second one on that one? Okay. So the diabetes prevention program was in 2002. That's when it was published in the New England Journal of Medicine. And there it comes. They compared medication, metformin, with lifestyle and with nothing. So it ends up that the lifestyle was actually twice as effective as the metformin in preventing diabetes. And this is not making it go away, but preventing. So as life went on, I ended up leaving Loma Linda, and I taught for a year in the Department of School of Public Health, Department of Nutrition, and the medical school. And then our house was broken into, and my wife said, we are not staying in Southern California. So we moved to Northern California, where we worked quite a bit with the CHIP program. Some of you may be aware of the CHIP program. And my wife, Dina, was one of the principals in the Adventist CHIP Association. So I went around kind of teaching how to teach the CHIP program to the community. So we had that experience, and from there, we moved to Lifestyle Center of America. Now, Lifestyle Center of America is a rather interesting place. It was built with oil money. A fellow by the name of Odie Johnson, who happened to drill the first oil well in kind of the Texas, Oklahoma oil fields, Heelton oil fields, they call them. And so he had quite a bit of money. The son, I guess, went to medical school but ran the oil business most of the time. And when he knew he was going to die, he got a group together and said, I want you to build a lifestyle center. So this was built in the 1980s, I believe, somewhere, and I don't remember the exact date. So I went there, and for most of 5 years, spent some time as the medical director, helping people make changes. I had seen people like Ralph make lifestyle changes and improve their disease. I had seen people in the CHIP program. We ran it in our community as a group, and people got better together. There's power in doing things together. There's power in a group. The Lifestyle Center is a place where people come very motivated to make changes. In the office, I had to motivate people. In the community, you have to motivate people, and the stories tend to do that. But to have people come, and these people were having to pay $7,000 to $8,000 a piece for an 18-day program, and they would come hoping to get off insulin, hoping to lose weight, hoping to lower their blood pressure. So all kinds of challenges they had. And one of the people that I had was named George. Now, George did or we're going to call him George, ran a nonprofit on the left coast, over there in California somewhere, and he found himself with a heart attack lying in the intensive care unit, getting treatment. And he says, I've got to do something about this. He had diabetes, and someone told him about the Lifestyle Center for America, and so he came. He showed up on insulin, obviously heart disease, and at Lifestyle Center for America, we had the ability to control people's environment much better than you can at home, right? At home, you can hide Twinkies or whatever you like, and even accidentally stop by the donut shop. They are called do-nots for a reason, right? So, and they do have an incredible magnetism, so it tends to kind of pull you in. So we had control. We were out in the country. You can kind of see the picture of the place there, up on a hill overlooking what they call the Lake of the Arbuckles, kind of out in the change between forest and desert part of the country. It's kind of forest disappears slowly in Arkansas and then Oklahoma and then turns into desert by the time you're on the other side. So George put everything he had into it. He accepted the 2 meals a day, don't eat the supper. He did the 3-day fast. He exercised whenever he could. He wanted to come off insulin, and so we took him off while he was there, and we had good control on things. When the end of the program came, Ralph was not quite ready. He still needed a little bit of insulin, but he begged. He said, Doc, I really want to come off insulin. And so I said, okay, George, you have to stick with this in order to make it happen. If you keep doing what you're doing, you'll keep getting what you got. If you go back to the old way of living, the old diseases will return. And I was very pleased that George came back at 6 months afterwards for a little refresher, kind of a long weekend sort of a thing. And so I was able to get some of his numbers. And look at this. Isn't this encouraging? So his A1C was 8.8 when he came in initially. Afterwards, it's just 18 days, so it wasn't worth doing another A1C. But at 6 months, you can see it's down to 6.4. And his medications have decreased significantly. He was on a whole bunch of them because of his heart attack, diabetes, and hypertension. They decreased by the end of the program. His blood pressure actually was still excellent. His weight was down 15 pounds in about 16, 18 days, so it's pretty good, right? A lot of that's water. And then by 6 months, he was down a total of 48 pounds, and he was off insulin. His blood sugars were normal. At the bottom, you can see a fasting blood sugar of 78, and then an 84 just before breakfast, 2 hours before eating, or after eating, 143. Lunch, 107, just before lunch, just after lunch, 2 hours, 125. So his blood sugars have almost returned to completely normal in about 6 months, off of insulin. I was able to, again, decrease his metformin a little bit as he continued his journey. Isn't it exciting to see that happening? I know for myself, working in a place like this where every 18 days I got to see miracles like this happening over and over again, were a great encouragement and helped me on my journey in medicine. So telling people is also a bit of a problem. Now that we know it's reversible, don't we have a responsibility to let people know? I mean, certainly the doctors do, and I would think that others would like to know as well. So this particular slide is to remind me to tell you a little bit about what happened in Groveland, California. Groveland is a little town just at the north entrance to Yosemite National Park on I-120. This is where I was practicing after leaving Loma Linda. And we started this CHIP program in the community. At first there were a few, but the few had some successes, and those stories got out. So the second time there were more. I think we ran it over the 7 years around 7 times. It was encouraging to kind of see that happen. The power of the group, when there's a group of people and they're listening and they're hearing, and they hear somebody say, it would be really good if you cut way down on your supper, or eat more beans. Some people are going to say no, and other people are going to say yes. And when they do, they come back and share the positive results. And the people who are resistant at first say, wait a minute, if they can do it, I should be able to do it too. So that's the way a group tends to encourage each other. And it was really neat what happened over the time we were there. One gentleman had a PhD in biology, I believe, who was a contract worker for the federal government, so he would fly out here to Washington, D.C. Quite a bit to do his work. We figured he was educated, would figure this out. He said he had to go through 3 times before it really sunk in what was going on, even with his education. Third time he says, I've got it. And then his weight began to really come down, his blood sugars improved. So it's a powerful tool to make a difference in the community. The alumni formed a group, and they would plan on things, right? They had parties that were more plant-based and less sedentary. They formed a group. Have you all seen these signs, keep America clean sort of a thing, trash picked up by? So there's, last time I went into Yosemite National Park, which has been several years ago, the sign was still there, this highway cleaned by the Groveland CHIP Association, right? So making a difference in the community and helping people's lives. So it's quite powerful. Let's see. Hope makes quite a big difference. This is kind of that another slide, same thing. So at Lifestyle Center of America, we asked a rather interesting question. We wanted to know if what we were teaching people was actually making a difference at time, right? So we called people, first at monthly intervals, and then at 3 quarterly intervals, and finally at 1 year. And we looked at their how much weight they had lost. This was their self-reported weight. We were very encouraged out of the, what does it say up there? That would have been 2002, March through February of 2003, 172 came through the program, the average age of 56.9, and 100 females, 72 females, average weight 214 pounds, with diabetes, obesity, hypertension, heart disease, and then, of course, other diseases. And at 1 year, we called them and asked about their weight. It was very interesting. Only 2 people weighed more 1 year later than they had at the end of the program. Not the beginning of the program, but at the end of the program. The people who had lost the most had lost like up to 60 pounds. So that was encouraging. And we asked them a bunch of questions about behaviors, because, what behaviors make the most difference? Is it exercise? Well, it ended up that throughout the group, everybody was exercising about the same. Exercise did not make that much difference. We asked them about the type of exercise they did. We asked them about the water they were drinking, etc. Well, the things that seemed to make the biggest difference were and the question they were asked when they were called on the phone was, how many days in the last week did you have 100% plant-based? And that seemed to be the one that made the strongest difference, and you can kind of see the statistics there demonstrate that to be the case. I'm encouraged that people who decide to make the changes can actually continue to do those changes and gain benefit. 2009 Banting Award went to Ralph DeFranzo for explaining to us that diabetes was rather complex. He called it the ominous octet. And there's a whole bunch of things going on that in the body. It's not a simple disease. We tend to think of diabetes as just a blood sugar problem. It is not. It is much more complex. There's the insulin resistance. There's what's happening in the pancreas cells, in the livers, in the fat cells, the gut, and just the kidneys. It's really all over. Even the brain gets kind of confused. So that makes it a much bigger problem than just blood sugars. I have the pleasure of being at the American Diabetes Association meeting in 2004 when Michael Brownlee gave his Banting Award lecture, in which he demonstrated that the problems in the blood vessels from people with diabetes comes from a backed up Krebs cycle. Okay? All the energy being pushed through it from too many calories makes a lot of reactive oxygen species, which stops anaerobic respiration. I know it's going over some people's heads, but some of you understand what I'm talking about. And that makes all the other things happen. So just letting that system run, taking the calories down, helps to fix it. Both fat and sugar and, interestingly, protein can drive the Krebs cycle. So it's not simply a sugar problem. We've known since the 1960s that you could give healthy medical students, whatever that means, a whole bunch of fat, and you'll turn all their diabetes tests positive. So it's really the calorie issue. So Michael Brownlee got that award for giving us that. And then Roy Taylor, what does it say, 2012, got the Banting Award from the American Diabetes Association for demonstrating the reversibility of type 2 diabetes. Absolutely amazing to see it actually finally in the literature. Anybody with diabetes have their doctor actually tell them that the diabetes was reversible? It's interesting. It usually takes about 10 years before the medical community catches, those practicing medicine catch up with the science. And if I figure correctly, it's been, what, 10 to 11 years now, right? So it's about time that it should be accepted. So it was pretty amazing. He had a group of people which he put on a very low-calorie diet, something like, I remember, 400, 600 calories a day, and was able to demonstrate that the fat in the pancreas was leaving, the fat in the liver was leaving, and the insulin resistance improved. Normalized. I am not 100% sure on your interest at this point. Does anybody have a question? No? Okay, I'll keep talking. So he had people with type 2 diabetes who were recently diagnosed as having diabetes. 25% of their usual calories, 600 kilocalories Optifast, and non-starchy vegetables. So that was kind of the above-ground vegetables tend to be best. And then used an MRI to measure the fat in the organs, which was rather unique at that time. And the results showed that the blood sugars turned to normal, the liver glucose release was suppressed, and interestingly, there was no real change in the muscle insulin sensitivity. And then they checked to see how well the pancreas did using functional tests. It was very interesting. Usually when someone has a normal physiology, when they first eat, there's a bunch of insulin that comes out all of a sudden, and then it drops down. And he found that, well, that goes away when someone gets diabetes. It's the first thing that goes away when type 2 diabetes comes. And so he found that that was actually restored within the, within the several weeks of the intervention. Since that time, Dr. Taylor is in England at Newcastle University, so kind of north, what would that be, northeast England. They took his information. He's actually part of the study. There's now, and it should be almost over now, a study called the DIRECT trial, where they're working in family medicine or primary care doctors' offices. And they put a nutritionist in the office. There's a group where there's no intervention, and then those that get the intervention using something similar, putting on a very low-calorie diet. And what they found was at 1 year, there was a significant reduction in the people who had diabetes. That is, there was a reversal. So 49 practices, 306 individuals. It's a randomized controlled trial with intervention versus best practice. That is what the ADA would recommend. People who were in the trial had had the diabetes for less than 6 years. They were aged 20 to 65, BMI from 27 to 45. So they were placed on around 825, 850 calories for 3 to 5 months, and then they had food kind of added back in. Immediately, interestingly, they stopped their diabetes and hypertension medicine when they started the program. Why did they do that? Because often when people make these dramatic changes, these numbers change so fast that you can actually cause people to faint from their blood pressure dropping too fast or their blood sugars drop too low. So the doctors just stopped all the medications when someone started into this study, and then they added them back if they were necessary. So that's the way that was managed. So interestingly, you can see the, I think, orange bars up there and the top are demonstrating the percentage of people who reversed their disease went into what they call diabetes remission in the group that was in the intervention, and the blue bar is those that were in the control group. So a significant improvement. As a matter of fact, the number needed to treat was 2. So in medicine, we talk about the number needed to treat to help us understand how effective a treatment is. For example, if you have to treat 450 people with simvastatin for a year to prevent a heart attack, we would say the number needed to treat is 450, right? So for this particular intervention, the number needed to treat was 2. For every 2 people you treated, 1 person had a reversal of their diabetes. That's pretty dramatic and much more powerful than any pill, obviously. So now that's out in the literature. They've reported the second year, and we should be getting the report on the 4th year data here pretty soon. So pretty exciting now to know that we're understanding that diabetes is reversible. I was pleased when I saw this article in literature. This is from Van Omen from Scandinavia, and they looked at the literature, all the literature, and summarized it. This is what we need to do in order to change the way medicine is practiced, the way communities are set up, in order to get rid of chronic diseases. And he's pointing first at diabetes, but also saying, you know, this works for heart disease and hypertension as well. It's encouraging to know that the scientific community is beginning to support lifestyle medicine, changing our lifestyle to a healthier lifestyle to actually bring about a cure, changing diabetes care to diabetes cure. For those of you who have had diabetes and visited your doctor, the message is often something like this: we're going to help you die as slowly as possible. We're going to try to keep you alive as long as we can. This disease is going to get you. The hope is not there. Well, the science tells us there is hope. Now, not everybody can reverse their disease. Not everything about diabetes is reversible. If you have a foot amputated, you're not going to grow it back. If your kidneys are all scarred up, it's not very likely that you're going to be able to fix that. If the eyes, if you're blind, probably won't come back. But much of it is reversible, and the earlier you catch it, the more reversible it is. Interestingly, within the last year, the American Diabetes Association came out with a paper talking about what words we should use. And they don't like the word reversal. They want to use the word remission. And remission, in essence, is saying, you go back so it's no longer meets the criteria, but it can come back again. And that is absolutely true. If you keep doing what you're doing, you'll keep getting what you got. If you go back to eating the way and living the way you were, the disease will come back. So they're suggesting now that we use the word remission rather than reversal. And I would argue that the kidneys may have some reversal of the disease, right? The muscle may have some reversal of insulin resistance. The liver may have reversal of its resistance, but the disease is going into remission. So that's kind of the way we're talking about it now. So this is Van Omen's kind of a representation of the complexity of diabetes. There is no pill that will fix all those interactions. You have to fix the whole lifestyle to really make it change, and it can be really quite dramatic. So just one more story. I think we're getting pretty close to the end here. After spending about 5 years at the Lifestyle Center of America, I was invited to come to that little town, Orlando, in Florida, and teach at the family medicine residency. So I spent the last 15 years there helping to teach the young doctors not only about how to be a good family doctor, but also how to do lifestyle medicine. And we're beginning to make some progress now. We have a lifestyle medicine curriculum that has been encouraged, put together by the American College of Lifestyle Medicine. So that's all helping things. Several years ago, I think it's been 6 years, 7 years, maybe 8 years now, we got a grant, first from within the hospital system and then from without, to hire a nutritionist to come and do some lifestyle intervention, teach the plant-based nutrition, teach the exercise and those types of things. And so I was very pleased to be able to have someone who was bilingual, could speak both Spanish and English, and was able to teach that class. One of the people that came to the class was the husband of one of our employees, who we're going to call Keith. Keith worked in the building trades, kind of fixing properties up and whatnot. And one of the things he was very clear about when he came in was, no way I'm able to give up my meat. So we encouraged him to move to plant-based. He heard other people in the class doing the same thing. And their sugars were improving, their weight was coming down. He decided to do the same thing. And over about 1.5 years time, he kept coming back. Time after time, I met with him as a doctor and could actually bill for that time in the clinic. And of course, they watched the videos and listened to the nutritionist. And over that time, kind of kicking and screaming the whole way, he had significant improvement as his blood sugars came down, and he didn't need to take insulin, and his weight came down. Just a great response. We had another employee, actually, who lowered his A1C. This was the most dramatic one. From, if I remember correctly, it was about 12.5, 12.5, so it was super high. And he dropped it down to, if I remember correctly, I don't think I have it up here, 5.8 in about 4 months, which was really dramatic. Came off all his medications. So he had been doing all the things wrong. He was not really advanced in his diabetes, but he was able to make the dramatic change. It doesn't happen that way for everybody. But we had him come in and talk to the young doctors and say, this is what I did, and this is my numbers before, and these are my numbers afterwards. And then we got the doctors referring patients, right? And over a couple of years, we were able to reverse the diabetes, that is, bring the A1C down under the diabetes range, take them off all medications, 22 different patients. Isn't that neat? It's encouraging, and it kind of shows you that it can be done in a clinical setting. We can make a difference in the community It should not be just something that's happening in the ivory tower. There it is. That's key, I guess. 8.5 down to 5.4. Weight came down, and blood pressure has stayed well, and he's off a bunch of medications. Well, we've used up our time, and I trust that you have found this at least of some interest. As Seventh-day Adventists, we understand something about the health message, although when the health message gets a little too close, it makes us uncomfortable. And what I mean close is when your hand is reaching for those Oreos, right? It's really hard to say, well, just this once. We kind of negotiate with ourselves. Making the lifestyle changes, engaging all of the 8 natural doctors, if I can use that idiom to kind of speak of the whole of lifestyle. There are incredible things that can happen. For those, oh my, just 1 minute left. I'll say this. Are you ever too old to make lifestyle changes? My wife's grandmother